Some inequalities that I've seen in the healthcare industry are racial profiling, lack of access, and language barriers.
Discrimination over the poor versus the rich, how people who have more money get the best treatment, and I think everyone deserves equal treatment, doesn't matter how much money they make. All about how much money you have, who knows who.
Health inequalities connect with race because since the health industry is so expensive to seek care, treatment, and medications, it impacts our most vulnerable individuals in the U.S., which are our communities of color. Decades of oppression and injustice have caused these communities to not make enough of an income to be able to afford the care that the health industry itself places a huge price tag on.
If I could change anything about the healthcare system, it would be its accessibility, depending on if a person has an insurance or not.
One thing I would change about the healthcare system is make it free.
The lack of access to hospitals, clinics, and grocery stores in locations where communities of color live.
Mental health is ridiculously expensive, and most insurances don't cover the cost of treatment, therapies, medication.
I really didn't understand it until my mom became pregnant with my younger sister, and then I was kind of like, you have to, when she went to the doctor on checkups, they'd be like, you have to do this, you have to do that, you can't smoke, you can't do alcohol, you can't drink, and it's kind of those are the basic standards, but they constantly repeat it in a way where they're like, we know, this is your race.
I get doctors need to be paid, but I think they need to be funded a different way than just paying $10,000 for a bandage.
When certain patients, usually people who are white or Caucasian, will not take certain doctors, usually the doctors of color, because they do not trust what they do and the education behind what they have gotten, because they are of color.